Awesome. Thank you so much, Katerina.
Mhm.
All right, with that, we're going to pull back up the PowerPoint slides. Carlos, I'm going to shoot it over to you to walk us through our housekeeping items for the evening.
Yes. Well, welcome everyone. Again, this is Carlos Velasquez. Been happy to serve on the city's recovery task force team, and just some housekeeping notes. This meeting will include interpretation in Spanish and Vietnamese, and gracias and welcome to our interpreters for today, Aida, Carolina, Han, and Quinn. So to access the interpretation in Spanish and Vietnamese, click on the interpretation button on your Zoom screen and then select the appropriate language. In addition, the interpretation for all of you is set to off. We recommend that if you want to hear the interpretation, if you want to hear all the interpretations in the English channel, in English, to go to the English channel so you can hear all the interpretations in English. So we have two videos, one in Spanish and another in Vietnamese that will play right now.
Hola y bienvenidos a esta reunión. Para acceder a la función de interpretación, haga clic en el icono del globo en la parte inferior de la ventana de Zoom y selecciona el idioma que desea. Para escuchar claramente el audio de interpretación, le recomendamos que también seleccione la opción para silenciar el audio original, que es la opción más baja en el menú después de hacer clic en el icono del globo.
Xin chào và cảm ơn quý vị đã tham dự buổi họp ngày hôm nay. Để truy cập vào phần thông dịch của ứng dụng Zoom, xin nhấn vào biểu tượng hình quả địa cầu ở phía dưới của màn hình và chọn ngôn ngữ theo ý muốn của quý vị. Để nghe rõ lời phiên dịch, chúng tôi khuyến khích quý vị chọn chức năng tắt âm thanh gốc nằm ở phía cuối trong phần tùy chọn của biểu tượng quả địa cầu.
Great. So task force members, we ask all of you to rename yourselves on Zoom by first and last name, and to also add your organization name so we can ensure that you're identified as a task force member. All you have to do is click on the three dots on the top right of your screen of your image, hover your mouse over your name, and click on more and then rename. Also, if you're an alternate, yet still have your primary representative in attendance, please add alternate to your title. That would be helpful for us when we take votes on an action. This meeting is open to the public. Saludos to all of you. Thanks so much for being here. You'll be able to see and hear tonight's meeting, and you will have the opportunity for 2 minutes time to share your voice and comments during public comment portions of tonight's meeting, which will happen, I believe, a couple times during the agenda today, and we'll be sharing that, and especially including at the end of the agenda. Until then, we appreciate your patience during the rest of the meeting. And for task force members, there will be time after each section for questions, and we ask that if you do have a question during that time, to use the raise your hand feature found below on your Zoom screen. We will announce your name so you can unmute yourself. And when you do unmute yourself, just make sure to introduce your name and your title again, just for to make sure that this is accessible for everyone. So I believe that's it. Go back to you, Rosalind.
Great. Thank you so much, Carlos. We start our task force meetings acknowledging that we are on the ancestral lands of the Ohlone people. We pay respect to their elders, past and present, and we give thanks to their sacrifice and examples of humility, stewardship, and resilience. So with that, we're going to jump into the agenda for this evening. And next slide. So just review the agenda very quickly. We're going to start off with some task force updates. The main portion of this evening's meeting is reviewing the final recommendations and budget allocation. So there'll be a very brief update presentation from staff, followed by an opportunity for public comment. If there are any members of the public who would like to speak on the recommendations, they'll have time to do that. After which there'll be task force questions, answers, discussion, and a vote on the recommendations. After which we're going to talk a little bit about next steps and our implementation framework. Well, hoping, because this is our last task force meeting, the last time we're going to be together as a group, to have an opportunity for task force members to just share about the process, hoping to have a little bit of celebration. We will end the meeting with public comment. So with that, next slide, I think we'll go over the updates. So very quickly, city staff last month on October 24th at the city's Community and Economic Development Committee provided a status report to the committee on the task force process. At that time, we were able to share about the community engagement activities and letting them know that you all were finalizing the draft recommendations and getting ready for presentation to City Council. There was a recovery task force steering committee meeting on October 26th, helped to prepare the agenda for this evening's meeting. Also had a discussion about further refinements to the draft recommendations. Also, we want to acknowledge and really thank the letter of support that received from Cise Puede regarding the task force recommendations and how many of the draft recommendations align with the vision of the collective. So thank you so much. We sent that letter to all members of the task force. It's also posted to our website. So thank you for that letter. In terms of an update on our Promotores program, just switching real quickly to make sure I've got the latest information. Since September, our promotores have been able to reach over 8,000 residents. That's really pretty phenomenal. They've been educating our residents on the city's recovery resources. They've been knocking on doors out in our communities. They have been at events, tabling at events, and attending focus groups. They've also participated in about 33 different events, and those have ranged from back to school night at McKinley School. They've participated in Viva Calle, and they also participated in the Project Hope Halloween event at in the McKinley neighborhood. So really super excited about the work that our promoters are doing, making the connections in our communities most impacted by COVID-19. So shout out to them and very thankful for their work. Another announcement we want to share with the task force, and we will follow up with you in an email to make sure everybody has this information. The County of Santa Clara announced that it will be launching a community-based organization grant program using $10 million in American Rescue Plan Act funds. This is really super exciting. I wanted to make sure all of you were aware. The county is partnering with the Valley Medical Center Foundation to administer the grant program, and really delighted to know that the county received input from many stakeholders. Many of our task force members here, they got input from the Silicon Valley Council of Nonprofits and the Racial Equity Action Leadership Coalition. So very glad that those groups were able to participate and help shape the program. There are 2 grant categories of up to $150,000 each that CBOs can apply for. So again, we'll send this announcement and all the details out to all of the task force members after this meeting. And with that, we'll ask if any task force members have any announcements, news to share with the group. Now is the time to do it. So if you'd like to just raise your hand, we'll call on you. And I see a hand. First hand up I saw was Laura Buzo.
Go ahead, Laura.
Good evening. Yes, thank you. Good evening, Laura Buzo, assistant to the city manager in the city manager's office. Just wanted to share with you all that we are in the process of developing the Children and Youth Services Master Plan. And as part of that process, we are out engaging community not duplicating the efforts that all of you have done through your outreach and your community engagements, but really just leveraging some of that work and really wanting to hear from community, both service providers, families, and youth to help us inform and shape the master plan. But we are specifically hosting 3 community conversations for service providers. They are November 16th, December 6th, and December 13th. So we invite you to choose one of those that fits your schedule, and we would love to hear from you on what your vision is for children and youth to help us develop the Children Youth Services Master Plan. Thank you.
Great, thank you so much, Laura. Anyone else? Jeremy.
Hi, everybody. Jeremy Barus here with the Si Se Puede Collective. I just wanted to touch on the letter from the Si Se Puede Collective that you all received. So, it's an opportunity to make these recommendations to council to fund these recommendations through the budget process, so that this process continues to be ongoing, that it just doesn't stop with the end of this task force. So that is the intent of the letter. And I know we're going to talk a little bit in the next agenda item around the recommendations, but I just want to just share a little bit of the intent of the letter that was sent out.
Great, thank you so much, Jeremy. Araceli.
Sí, permíteme, hola. Quería solo dejarles saber que habrá 2 reuniones de la comunidad. ¿Sí se escucha? Sí, ¿verdad?
Sí.
¿Sí me escuchó?
Sí, te podemos escuchar, Araceli.
Bueno.
Sí, te podemos escuchar, Araceli.
¿Sí se puede escuchar?
Sí, sí te escuchamos.
No te escucho, Carlos, solo te veo. Pero entonces, ok, perfecto. Entonces continúo. Habrá 2 reuniones de la comunidad. Va a ser sobre la ley de oportunidad comunitaria de compra. Esta reunión consistirá en una breve presentación de un proyecto de programa COPA. Se revisará y seguido habrá tiempo para preguntas y respuestas. Se va a ofrecer traducción en español y se proporcionarán pequeños refrigerios y va a haber actividades infantiles supervisadas. Va a haber 2 fechas. Una es por Zoom, el 14 de noviembre de 3 a 5 de la tarde. Y la otra es en persona, el 17 de noviembre de 6 a 8. Les envié los volantes, no sé si los miraron, pero si no puedo volvérselos a reenviar después de terminar la reunión. Y también ya viene de nuevo la feria de recursos de la oficina de salud, la que está por la Story King. Va a ser de 1 a 4 de la tarde, el viernes 18 de noviembre. Por si gustan y conocen personas que quieran asistir. Y también igual si no les llegaron los volantes, me dejan saber y se los puedo reenviar para compartirlos. Gracias.
Thank you, Araceli. We did receive the flyers and we will share this and share it in our email to the task force along with other updates that we received today. Any other updates or comments from task force members?
Okay, well, great. Thank you all for sharing the information. Really appreciate it. So next, I think it's time to just jump right into the first agenda item. So the next slide, I'm gonna hand it over to Aurelia Bailey. She's gonna walk us through presentation of the final recommendations and those changes since the last task force meeting. Aurelia.
Thanks, Rosalind. Good evening, everyone, and can't believe this is our last task force meeting. My name is Aurelia Bailey, and I am also part of the city's recovery task force staff. So I will be going over, the first one on here is the implementation categories. Just to give you a recap, at the last task force meeting in October, you voted a no vote that evening to further discussion and to have a further discussion at the steering committee that took place October 26th, and that tonight the task force will take a final vote. So also at that last task force meeting, a member actually suggested for us to do an implementation, to add the implementation category. So I know that all of you already have had or have gotten many emails from us and have this as part of the attachment. And so as a result, each of the 88 recommendations has been categorized according to staff analysis. So the first one, which is one, is already underway in a department work plan. An example of this is from the Housing Committee. The recommendation was to develop a multi-platform tenant resource center. The Housing Department is actually working on launching this project and will be able to spend the funding attached before the end of this fiscal year. The second implementation category is City Council policy decision. We know that several of the recommendations will need to be updated in regards to policy changes or policy updates. So this will require for us to go to the City Council for approval. And then the last one, category 3, which is additional evaluation and or resources required as a recommended for city, or an example is recommended for city initiatives roadmaps process, which is basically the category. This category is going to need additional things, so it's probably going to take a little longer. But I know what does this mean for all of you, and like many of the steering committee, what happens next. So hold your thoughts, because in the next few slides, we are covering additional refinements on some of the recommendations. And then we'll cover that on some next steps in terms of where we're going from here. So I will hand it off to Carlos for the next slide.
Yeah, so other updates that we received, or other updates to the recommendations since our last task force meeting, was that was focused on recommendations, which we'll share now. So under the Child Care, Early Care, and Education and Youth Development Committee's recommendation 4.3, there was a suggestion at the October task force meeting to add to the recommendation where those programs are eligible to use nutrition programs like the Summer Food Service Program to ensure that the children that are participating in these programs have access to meals while they're in this care. So we've incorporated this into the recommendation, as you can see in the text in white. There was also an additional suggestion to this recommendation to add language recommending that these programs who use the Summer Food Service Program be open to the whole community as community feeding sites, rather than closed and only for the children and youth who are participating in the programs. City staff suggests keeping the language as is. Changing the sites to open could create logistical capacity and administrative concerns for these organizations and their programs. Next slide. So another suggestion at the October 13th task force meeting under the same committee's list of recommendation was to add the county as an additional partner to expand behavioral health programs under the committee's recommendation 5.3, which you can see again in the text in white. You can also see some edits in white to this recommendation and to 5.4. At the October 26th steering committee meeting, a suggestion was made to include language in these recommendations for opportunities to address mental health among young youth through a mentoring approach. So we did meet with one of the committee chairs, Yvonne Perez, to incorporate this suggestion into the recommendations. And we also shared these changes with the committee for them to review before our meeting tonight. So again, those edits are reflected through the text in white that you can see. And then a rather new slide that we just had just in the last half hour was we did receive a recommendation from one of our task force members, Dolores Alvarado, that for the Community Health and Wellness Committee, that for the partners to work with on career training programs, it would be community colleges that provide a community health worker certificate. So just adding a little bit more detail as to which community colleges we would want to partner with in this recommendation. So we were able to make those edits and that are reflected in white on this recommendation. So I believe that was the recommendations for Community Health and Wellness and Child Care Committee.
Thanks, Carlos. The last one is the Just Recovery for airport, hotel, and arts workers. Adding the word city, so it should say review of city cost associated with cultural programming and city-owned facilities, parks, streets closures. A lot of our art groups receive grants from the city, and those grant monies gets passed right back to the city. So this recommendation was to do a formal review of the city costs associated with these productions. So with that, I'm actually going to stop here because the next one will open it up for public comment on recommendations before we will hear from all of you, the task force members, on, and we'll have the opportunity for the task force members to do a Q&A, discussions, and a potential vote for tonight.
Gabriel?
Yes, thank you. Gabriel Hernandez, the director of the Si Se Puede Collective. We're 5 organizations in the East Side, Amigos de Guadalupe, Real Family Services, the School of Arts and Culture at the Mexican Heritage Plaza, Somos Mayfair, and Vegelution. First, we want to express our appreciation for all the work that the committees have done, all the city staff involved in this. Looking at the recommendations, it's such a great template. And the letter that we did send to you in the very first paragraphs say that we do support the recommendations that you all have made with the $2 million and how you've broken those up. So we support that. And then we're asking that that the task force itself also either do some kind of a cover letter to all the recommendations that the city do, and to the mayor and the city council, that they do use this as a template for their budget process when they're looking at the budget for next year and a couple of years to come. This is such a powerful group of people. To me, a very respectable group of people, and I think that you should use and wield that voice to say that we don't want these recommendations to die, that we want the city to really take a look at a number of these things. I believe all the committees were very thoughtful in those recommendations, and we just want to express that appreciation to that. If these are implemented, it would change a number of things. In the letter, you also see that we asked for $125 million, and not from this process itself, but that included in our view of the impacts of COVID, a clinic in our neighborhood and stuff. And so, but again, we just want to thank you for your time.
Thank you so much, Gabriel. Next hand I see is, oh, go ahead, Carlos, I'm sorry.
You're going to call on Melissa.
Hi, good evening. My name is Melissa Gonzalez. Buenas noches. I am the Director of Program and Impact Latinas Contra Cancer. Latinas Contra Cancer is a member of the Racial Equity Action Leadership Coalition. The budget-adjusted work group of the Racial Equity Action Leadership Coalition is supporting of the current recommendation and allocations. We also recommend that the Recovery Task Force find that $2 million for these important approaches is not sufficient. Lastly, we ask the task force to recommend to San Jose City Council that the founder recommendation should be used as a template for upcoming budget decisions at mid-year and in decisions about fiscal year of 2024. Thank you.
Thank you. I'm looking for any other hands, members of the public who would like to speak before we go to the task force. Okay, I don't see any other hands. So with that, Aurelia, you are ready to go to task force members for any questions or comments, discussion.
Yeah, so with that, we're opening it up for all of you. Oh, Luis, we're going to open it up to all of you for Q&A, and looks like Luis has a question.
Yes, thank you. I wanted to ask, are we going to vote first on the recommendations and then vote separately on the implementation plan?
So our strategy is for the task members to actually vote on the recommendations. The implementation framework right now is up for discussion. So we're going to talk about that next in the meeting. And right now, staff is just wanting to share some of the ideas around the implementation framework, some of the things we're thinking about moving forward. But it is a work in progress. And our first step is actually to get the report first accepted by council next month. And then staff, we do have some ideas about how we would move forward in implementation, including how we would continue to keep the city council and all of you all and members of the public up to speed on progress on the work in terms of moving the recommendations forward. So no vote. I'm sorry, it was a long way to say there won't be a vote on the implementation framework, but we're definitely open to hearing your ideas and suggestions regarding that.
Okay, well, in fact, I'll just make my comment then that I certainly support the set of recommendations as a whole. I think an enormous amount of work and thought by these members and by the community has gone into them. I have grave concerns about lifting up only 10 out of all those recommendations. I understand that those are all that can be funded, but the idea that work plans will be developed for those 10 recommendations and that the others, it's ambiguous whether or where they would move forward, regardless of whether they are budget asks or policy or program asks, concerns me a lot. So if we're only getting to vote once, I'm not sure that I can vote to support it with that question still hanging in the air.
Dolores.
Hi, good evening, everyone. And just a special thanks to Carlos for taking my call at 5:40 on the issue on community health workers. I appreciate that. I do have a question and I may be missing it. I may be missing the answer. We talked about the diabetes prevention and diabetes self-management program last time, which was part of the recommendations. I don't see it. Can you point me to it? Maybe I'm missing it.
I'm sorry, Dolores, can you repeat which one? Which recommendation?
Yeah, there was a recommendation regarding the city programs that are currently existing and funded for diabetes and chronic disease self-management that was in the recommendation to increase that amount and then RFP it out or put it out to the community. I don't remember the language, but I don't see it. Can you verify?
I believe it's the Community Health and Wellness Recommendation 2.6, which is the one that is one of the 10 recommendations that's being recommended for budgeting, for allocation of the $2 million.
Oh, I see it now. Thank you. Thank you very much. That's my only comment.
Great, thank you. Any other questions or comments? And perhaps I don't know if there are any other questions about implementation, certainly we're happy to do that conversation now if it'd be helpful for the task force members before you take a vote. We're glad to move that part up. I see David Lowe's hands up.
Hey, thanks, Rosalind. Just kind of following up on Louise's comments. I was looking back at the 1, 2, 3, and I think 1 and 3 are clear to me. For the 2, that's a city council policy decision. Is this then mean that this item, items that are there would automatically be added to a future agenda? Do we know what the process would be for how it would be queued up to go before the council for their vote or their weighing in?
Yeah, that's a great question. So what we anticipate doing for those items that are policy decisions by the city council, we would be coordinating with city departments responsible for that particular area. We would want to evaluate existing city policies to make sure there weren't any conflicts, or if there was a policy already existing, if there was existing policy that could be amended. So we would be working with city departments to evaluate all of that. And then after that evaluation, take a recommendation to city council. Again, let me just share, 88 recommendations is a pretty big number. And so it's going to take staff some time, right, to go through them all. Initially, our thoughts is that we would immediately move forward with those 10 recommendations that the task force is currently recommending getting allocation of the $2 million. We would continue to work with our city departments on moving those forward. On all of the other items, I mean, we're based on the other categories, we would be working with city departments to develop work plans to determine what steps we would need to take. Again, evaluation of existing policies, programs, and then bringing those items to council. I imagine we would be grouping similar recommendations together so that we would probably do them in batches over time and taking those things that require city council action, taking them to city council. Implementation is going to be for the long term. It's not necessarily a short-term process. And clearly, we would be doing this in tandem with the city's budget process. We know how important that is. So absolutely, for those items where we're determining more funding resources are needed or staffing resources are needed, we would be working with city departments and taking those in tandem with the city's budget process. So unfortunately, we don't have a lot of details to share with you about how this all will play out or a time frame. This is why also staff will be recommending to City Council that we as staff provide regular updates, continuing through the Community and Economic Development Committee. We've been doing that the last year, providing them updates actually quarterly. So we would continue to provide updates to them. And then, I'm sure there would be cross-referencing some items to the full council for action. So right now, that's pretty much what we anticipate. But we're talking about, right, a multi-year implementation program.
Thank you. That's helpful. Just for context, do you guys know how many fit within the recommendations fit in 1, 2, and 3? Because I think that'd be helpful to know if many of them are already moving, what balance of them are in this 2 or 3 buckets where it's a little bit less clear the path forward.
That's a great question. We can tally that up for you real quick. I can get that answer to you shortly, David.
Thank you.
Thanks, Rosalind. I see Christine had her next hand up.
Yeah, so thank you for that information. That really does help kind of get a better picture. But I'd like to see if we could get an even more clearer picture, in the sense that, well, right now I fully get it. You don't know timelines. You know, understood. However, one of my concerns is that we've done a heck of a lot of work with this. And I would hate to see any of these fall by the wayside, being tucked away in a drawer after, pardon me, after X number of years. Is there any kind of indication or any way we could have a better clarifying statements of just how will you make sure that all these different great ideas that we've had, that we worked so hard on, really do get looked at and worked on?
Yeah, thanks again, Christine. Yeah, like I said, it's going to be a process as staff moves forward into implementation phase. I think for us, the one way that staff can be held accountable to move recommendations forward is that, you know, reporting to City Council through the Community and Economic Development Committee. As I mentioned, that's the committee we've been reporting to. And so one way to hold us accountable as staff and moving things forward is to do those regular updates to the CED committee. And again, my apologies, but I want to be transparent because 88 recommendations is going to take some time.
Yes.
And we're going to have to be working with city departments, and not just city departments, but some recommendations require us working with community partners and working with the county. So there are other entities that we're going to have to coordinate and collaborate with as well. But certainly we understand you all have spent a year volunteering your time and your talent and your resources, and we totally understand the importance of moving recommendations forward. I'm very thankful that in the city manager's office, we do have a team. At least we have staff who are dedicated to this work right now. And so we've got staff available to make sure that we're moving things forward.
Thank you.
Thank you, Christine. Ellen, we can, if you can wait until another round of public comment, would be appreciated. Jeremy, I think your hand next.
Thank you, Rosalind, for kind of sharing a little bit of the next steps. I know, I'm going to be sifting through the recommendations and, going to the Community and Economic Development Committee. But do you have a sense of kind of like the timeline or when the recommendations will ultimately make it to council?
So in terms of the task force report, this list of 88 recommendations and the funding allocations, we're going to be presenting those to the City Council on December 6th. So our recommendation will be that the City Council accept your report. That's going to be our recommendation. Also, we're going to be recommending that the City Council direct staff to provide regular updates to the CED committee. We're going to be including that as well. So that's the immediate next step.
Got it. Thank you.
Thank you, Jeremy. Dr. Dewan, I think you had your hand up next.
Thank you so much. I wanted to ask a question, knowing that the Children and Youth Services Plan and the work of engaging with community and other partners is underway. The degree to which the work that's been done over this last year with this task force could be shared with that team, and the possibility of avoiding duplication of effort to potentially include some of these recommendations as part of that planning process?
That's a great question, a great recommendation, Dr. Dewan, and I think Laura Buzo, my colleague, one of the in the city manager's office, who's helping lead the development of the Youth and Children Services Master Plan. She's been a regular attendee of our task force meetings, and as well as our community health and wellness and our child care committees. And so it's been a goal of ours since the beginning to make sure that the work that's happening here is also incorporated into the work of the Child and Youth Services Master Plan. So definitely our goal is to not have to duplicate work. So it definitely will be incorporated into that. This task force's work around children and youth services will be incorporated into that plan as well.
I'm wondering if that could be part of the recommendation that city staff will take to city council.
I'm sorry, Kim, what was that again, Dr. Dewan?
I'm wondering if that could be part of the recommendation, so for action by city council. So I heard Rosalind mention that the recommendation or next step will be for them to accept the report and to direct staff to give regular updates at the committee. I'm wondering if the city council might also, or if Rosalind's recommendation might also be for the council to direct staff to, share this report or incorporate it in some way with the planning process that's underway for the master plan.
Yeah, thank you again. I think that's a good idea, something that we can think about including it as a formal recommendation. I mean, also, Dr. Dewan, those recommendations that relate to or align with the work of the master plan, it's been noted that the expectation is that the city manager's office, it's Laura's job, right, to be incorporating those recommendations into the master plan process as well. But certainly we can make it more explicit and include it in staff recommendation.
Great, thank you.
Kira, I think you had your hand up next.
Yeah, I have a couple comments and then a question. I think, I too am supportive of the current recommendations. I think all of the recommendations are great and important. And I also think that $2 million is a very small amount of money for our community's recovery, and particularly the communities that were most impacted by COVID. I also am very sensitive to the fear of some task force members, and probably all of us, that this could end up like a coffee table book, like what happened with the recovery roundtable recommendations. Not that I was like specifically interested in all of those, but it was a process that happened that kind of just got shelved and nothing happened. So I think that's why you're getting questions about implementation, because it just feels like it could just easily be put aside. So I guess that leads to my question, which is there any reason, if let's say this group, if there's a motion to recommend these recommendations, to pass these recommendations, and then is there any reason why there couldn't be a motion, for example, to recommend to council that more money be immediately allocated above and beyond the $2 million for, let's say, priority one? Is there any reason why there couldn't be a motion and a vote on some recommendations right now from this task force about some implementation, details perhaps related to how often CED is going to hear these or consider these recommendations and hear reports from council? So just a couple questions there in addition to comments.
Yeah, sure. Maybe I'll take the latter part of your question comment first. So right now, staff we're thinking about, right, the cadence in terms of providing status reports to the CED committee. We were initially thinking annually. It could also be, I wouldn't recommend any more than biannually. Our main reason for that is because we need time, right? We need time to coordinate and collaborate, and we need time to make progress. And I wouldn't suggest any more than twice a year. So and that is going to be part of the recommendation, some type of cadence to the CED committee. And then the first part of your question, comment, Kara, was about the task force desire to also recommend to the city council future funding allocations and future budget years to implement recommendations, correct? Yeah, I think certainly the task force, you desire to make that recommendation. Absolutely. I mean, that's going to be part of our process as staff works with departments and partners and develop work programs and work plans. We are definitely going to be considering what recommendations could be funded in future budget years. That's definitely in our plan. So again, if you wanted to reiterate that in a formal vote, absolutely. I hope I answered your question. Is that helpful?
Yes. Yeah, just wondering, I don't know how it works for this group in terms of like Brown Act. So like, what are the limits of our, these recommendations that we might want to make to council? Are our kind of desires to see more investment and to hope that it could, more investment could be considered either at mid-year, let's say, particularly if there was a, we hear in February with the mid-year report that there will be a surplus. This group is not going to have a chance to get back together again and make another motion and make another recommendation. So this is kind of like our last chance as a group to make those kind of suggestions.
And just on the point of funding, just a reminder, just so that we don't lose sight of the total money that the city has received from the federal government for recovery programs. So just a reminder that specifically just in the American Rescue Plan Act funding, the city received $212 million. And so that money is already being spent by departments. So that money is going to housing, homelessness, it went to food and necessities, it went to Wi-Fi, other digital items, it went to small businesses. So the small business rent relief program that is underway by the city, that's being funded by the ARP funding. So, $212 million has already been allocated and being spent. And then in addition to that, when we look at the total dollars for recovery, it's well over $800 million. So I don't want task force members to think that the city is only allocating $2 million for all of our recovery efforts. It's well over $800 million. And so we got significant money, right, from the federal government to help our community recover. I see, Carlos, are you going to want to call on the next hand, or I can?
Yeah, I did also want to add it just to follow up on the question around tallying. We have there are 44 recommendations that have been categorized under implementation category 1. So they are already part of an existing work plan. So I imagine that we're talking about projects that are already have funding or have that are being supported through the $212 million American Rescue Plan funding. There are 13 recommendations that fall under implementation category 2, which require policy decision by city council, and then implementation. There's for implementation 3, there's 37 of the recommendations that are categorized under there. And I don't know if it's an even 88, because I think some of the recommendations have have multiple categorizations. Hugo, I think you had your hand up next.
Thank you. Yeah, Hugo Garcia with San Jose Jazz. Comment about, I think if we're looking at implementation through multiple years, or sort of having these kind of come up as, you know, as we can kind of get them into different plans and things like that that the city may be working on. Just to also then think through maybe like, you know, when do these particular, I think it then becomes important to decide, you know, what priority there is for these different things that need to happen. Some may need to happen sooner than others when we're talking about recovery and things like that. And so so maybe adding also sort of that element to it of just thinking through, you know, which ones need to happen sooner than others. I know that kind of throws another wrench in here, but I just thought that was something that maybe was important to bring up. The other thing I also wanted to ask a question. It's not, I know this looks pretty clear, but I don't understand it, so I'm assuming others maybe don't. In the number 1 where it says already underway and in a department work plan, I'm understanding it as is. I know that all the number 1s didn't receive funding, obviously, right? There are these 10 that receive funding that are number 1s, but what about all the other number 1s? Does that mean that those are already in a department work plan? Is that what department work plan? Is that is it this specific work group, or how does that work that it's already underway? I don't quite understand that. I'm sorry.
Yeah, no problem. So it depends on the recommendation. So for example, if the recommendation is related to the Department of Parks, Recreation and Neighborhood Services, and we've indicated that department already has a program underway related to that recommendation, and they're going to keep doing that. So that's what it means. I mean, to say that we've got 44 in that category, that's great. That means many of your, almost like half of your recommendations are already included in city departments' budgets. We've got resources, we have staffing, and so those departments will continue that work. So those recommendations are going to be implemented. That's actually really good.
Okay, so I'll just stick to the one I was a part of in child early care and education, looking at 1.3, strengthen partnerships with community-based organizations, not funded through this 10 that we've decided, but like you're mentioning, it's going to the library and PRNS and is being a part of that work plan that they're working on, right? That department.
That's correct. So that means this is something that those 2 departments already do, and they're going to continue to do, right? Part of their work plan, part of their mission, right? And that's work that they're just going to continue ongoing to do.
Okay, and then I guess the last question around that is, then would that department be like we're talking now? I guess that's where we're talking about possibly then having additional funds, or both like further years having these things be what gets funded later. Is that kind of what we're going at, or?
I'm not sure. You want to clarify your question? I'm sorry.
Sure. Yeah, I think there was a discussion around like the next group of possible priorities being funded later, or in the next years, or things like that in the future, right? Yeah. Is that where these are coming from the number 1s, or could that be number 2 or number 3 as well? That's, I guess, where I was trying to get an idea of what we were talking about there.
Yeah, I would say those would be the number 3 category, right? So the number 3 categories are the items that honestly we need more work. We have to do more evaluation. We're not sure if that recommendation can move forward. So we're going to be working with departments to evaluate that. We're going to be working with partners to evaluate that. We're going to be determining if additional resources are needed. So that means we're going to have to be formulating a budget proposal and then determining when that gets to city council, like what budget cycle. So So that means when it's additional work, it's a lot, it's additional staff, time, analysis, evaluation. And so right now we're not sure like when, if or when that recommendation would be able to move forward. So those categories of that category of recommendations, that's where staff will be spending a lot of our time, right? Analyzing, evaluating, prioritizing, figuring out how those would move forward.
Okay, that sounds great. And one final comment, sorry, I would just like to say too, I think through all the great recommendations, one thing I see maybe still missing a little bit is transportation and getting to these different things, whether it's a food distribution center, whether it's an arts center or a school or an after school activity, community center, whether all that stuff. So I don't know, it'd be kind of great to, maybe that's happening already in another in the higher plan that's being done already through the city. Working with like BTA or working with other transportation solutions in the city. But just wanted to bring that up here for everyone and put that out there, just that's an important element too, and wanting to just bring that to the table and say, let's make sure we can support that too in some way, or have connections, make connections and talk to the people around that topic in the city as well. So thank you.
Thank you.
Thank you, Hugo. Derek, I think your hand is up next.
Yes, thank you. Can you hear me? Yes.
Yes.
First of all, I'd just like to say thank you, Rosalind, and your staff and all the committee members on the task force for all the good work that has been happening and that you are doing ongoing to make this happen for our city. I did have one question regarding the funding that Rosalind had mentioned, $216 million, and then another bump of total $800 million. My understanding is that that $800 million bubble, that was emergency money during the heart of the pandemic to relieve, as you mentioned, housing and other costs. But the task force, the recommendations there is for ongoing situations for the future. And so that money may have some overlap, but it's not really specifically for the task force. Is that correct, or am I wrong on that?
Yeah, so specifically, the city council decided through the budget process to set aside a portion, this $2 million out of the ARP funding. So this is the ARP funding that are already being used for recovery services, for housing, for rent relief, for small business programs, for food distribution. So out of that pot of money that the city is already using to help in recovery, the council decided to set aside the $2 million for this task force process, so that the recommendations that you come up with, you would have a pot of money that you could immediately use. Like council doesn't have to take action, right, on the work that you've come up with and you've decided where that $2 million is going to be spent. You've done that. They've given you the power to do that. So there's no council action needed on that. They specifically set aside the $2 million for this particular process. But that's just one piece, like you said, Derek, of the overall money that has been going toward recovery.
Right. And thank you for that. And so that brings me back around to what others have said, that $2 million for the task force recommendations seems to be a bit sparse. And I agree, we need to bump that up. But yes, thank you for your explanation.
Thank you, Derek. Luis, I think you have your hand up again.
Yeah, thanks. I wanted to raise a couple things. First, I think it's really important to pull out that the recommendations that are marked in category 1, that doesn't mean that the city is already doing what the task force recommended. That means that the city is doing something in that arena. But a lot of our committees, I think, were familiar with what the city was doing and had specific recommendations for how that could be improved, how the processes could be that are currently underway could be changed or expanded, or different approaches taken to make them better meet community needs. So I think it's really important that whatever the next implementation steps are, that those category 1 recommendations are not left out, but that part of it is how do we make sure those recommendations are being considered in whatever the existing process is. And then my second comment and question is around the recommendations that are not specifically budget related. For example, in the Workers' Health, Safety and Rights Task Force, we have a recommendation around paid sick leave, which is, ultimately a policy decision by the city council, is not a budget decision. In housing, there's a recommendation to reduce barriers like required forms and certifications to accessing city housing services, which again might take some money, but that's a process recommendation. It's not primarily asking for more funding. So I'd like to lift up and ask, what is the procedure for moving forward those primarily non-budget recommendations? And could it perhaps be through considering them in the city roadmap process?
Yeah, potentially, yes, absolutely, Louise. So for those policy items, our staff would be coordinating, working with those specific departments that oversee that particular policy. A lot of coordination, obviously, with the city attorney's office as well. And then evaluating and determining what policy recommendation would go to city council. Yeah, but absolutely. And maybe let me insert this as well. When your report gets shared with the city council, right, they're, I'm sure, going to have interest in many of the recommendations, and because of that, they can use the city's roadmap prioritization process to include some of the recommendations in that, and direct the city staff to move forward on those recommendations. And many of those could be policy related actions, to your point, Louise. So that is another way that recommendations that don't require like specific funding, but it's a policy item, how they could be moved forward by the council.
Any other questions or comments from task force members?
Thank you. These are really good questions and a lot of good discussion will assist us.
So I guess if there are no more questions, I guess, Rosalind, we're at a point where we would, if folks are okay with the recommendations, we welcome a motion from a task force member to accept the list of recommendations and budget allocations that will be included in the final report.
Yes, and I think I heard in the discussion a couple of other items that the task force might want to also vote on. I think the first one is the council directing city staff to provide status reports to the Community Economic Development Committee at some type of cadence, and you can decide what you think that might be. And there was another comment that someone also wanted to include as a recommendation, and I wrote it down, but I can't find it. I think it was something Kara brought up. Staff, did you capture that? Let me see if I can find my notes.
I think I had recommended to include that the council directs staff to share these recommendations for incorporation with the children master plan.
Children and Youth Master Plan. That's right. Thank you so much, Dr. Dewan.
You're welcome.
Were there any other items, task force members? Kira.
Well, I'm not sure I know how to do this, but because I feel like there's a lot that could fit in this motion. So I'm just gonna throw some stuff out there. And if anyone wants to make a friendly amendment, I'm probably gonna say yes. So I think one is, my screen just froze, so hopefully you all can hear me. But one is approve the recommendations as they were changed from the last meeting. Recommend that council at the nearest possible juncture consider funding all of priority 1 recommendations. And 3 is at least, at minimum, biannual reports to CEP. For Dr. Dewan's suggestion, which I probably cannot articulate, but I think someone wrote it down. And what else did I forget? And I think something around the what used to be called the prioritization process, but now it's called the roadmap.
City initiatives roadmap process.
That our recommendation is that this would be happening at the same time as budget, but that that staff consider putting these priorities in front of council during the roadmap conversations. Maybe there's something better than that, but that's all I got.
That works, Karen. I do have one. I'm sorry.
I'm sorry. I was going to second that motion.
Thank you, Dr. Dewan. I just wanted to get clarity, Kara, on your item number 2. Recommend that council at nearest possible fund all. Was that category 1 recommendations? I wasn't clear on that.
Yes. Yeah, and I think, I don't want to condition this on a possible surplus in February, or that we learn of a possible surplus in February, but that does happen. And so I would hate if there were some really critical items in this set of recommendations. I would hate for this task force not to express some urgency, so that we don't need to wait until fiscal year 24 to have some of these further conversations. So that's at the soonest possible juncture. So, thinking that possibly there would be a conversation at mid-year.
Okay.
This is Raimundo. I would just say identify it, as soon as possible, and then taking into consideration the mid-year review of whatever. And just identify it. I mean, all they're going to do is say no if they can't do it. So you might as well just have it reviewed.
Yeah, I'm good with that.
Louise?
Yeah, I'd like to offer a friendly amendment if you two would consider. I think the category 1 recommendations are just the ones that are already in process, not necessarily the highest priority. So I wonder if we could say, all the recommendations that are funding requests, put them before council at mid-year budget and include them. I mean, obviously not everything will get funded, but
Right.
put them forward for consideration at mid-year.
Right. Yep.
Yeah, I'm fine with that if Dr. Dewan is as well.
Yes, I can accept that amendment.
Yep.
Okay, so just to repeat that, so all recommendations that require funding should be considered during the FY 23 budget process.
FY 23 mid-year, and then
Mid-year
yes, I think what Raimundo was his friendly amendment was specifying that it should be considered at mid-year, and then again at fiscal year 24 and during the roadmap conversation.
Got it.
And then fiscal year 25, and then fiscal year,
and ongoing budget cycles. All right, so we have a motion and a second. Kira's accepted the friendly amendment. We have a second. Is everybody clear and understanding on the motion?
Just for this Jesus Flores, just for clarification, if you can just read the full motion, the complete motion, just once more, Carlos, before we go and vote, I will.
So I'm a terrible note taker. I will have to defer to someone on our team who can repeat the motion.
I'm happy to take a stab at it. So the motion is multi-part motion. The first part is to approve the list of final recommendations. Part 2 is recommending that those recommendations that require funding be considered during the council's budget process or the FY 22-23 mid-year process, as well as future budget cycles. So 2023-24 and future budget cycles. The next part of the motion is that staff would provide biannual updates, at least biannual updates to the Community and Economic Development Committee. The next part is that the recommendations would be integrated with, considered with the Children and Youth Master Plan process.
Oh.
And then I have another item which probably could go in number 2, is that recommendations should also be considered during the city's initiative roadmap process.
Okay, I'm ready to vote.
Did I get it all, Kira?
I think that's right.
But it's better than I said, so thanks.
Okay. Well, before we go, thank you, Raimundo.
Sorry.
So I think we wanted to make sure that before, once a motion has been made, we wanted to open it up for public comment. So I thank you for your patience, Ellen, but I don't know if you still wanted to make a comment.
Yes. In looking at the community-based part, first I want to say it's been a pleasure to be involved and to be able to be present. I'm the chair of the Health Committee for the Santa Clara County on Aging. And there is a seat that belonged to the city of San Jose that has been vacant for at least 5 years that I know of. So hopefully that would be a natural place to include as you want to collaborate across the agencies. We'd be very happy to have that seat filled. And also the issue in the community-based part, implementation around mental health for seniors in housing is one of course, our most important issues. And we would welcome that collaboration. Thank you.
Thank you, Ellen. Any more public comment? Okay, I guess if there is no more public comment on the motion, we can begin with the voting on this. So again, this would only be for primary task force members. If by a show of hands using your Zoom icon button to raise your hand if you accept the motion as presented. And to confirm, I guess I should check in with our team if we have the correct number of individuals for.
Yeah, we want to make sure we have a quorum, so we need at least 28 task force members. I'm seeing that we have 27 task force members. We want to make sure if there is a task force member, a primary member that has sent their alternate to represent them tonight, let us know because that person can vote. And why don't we go ahead and
Okay.
count the raised hands now?
We count 22 raised hands.
Do you count mine? I put it up, then I put it down. Then I count it.
How many are we short?
Everybody keep it up then, I guess, right now, because I see 25 hands now, which if we have 27 task force members present, that's 25 out of 27.
Well, the concern is we don't have a quorum if
Yeah.
we only have 27 task force members.
Carlos, can you call out the names just to make sure that people know that their hand has been counted? Is that possible?
Sure. I'm just going to go from what I see here on my screen.
Yes, thank you.
David Lowe, Christine Fitzgerald, Edwin Tan, Jesus Flores, Rachel Monaco, Ben Roshke, Dr. Marianne Duwan, Hugo Garcia, Raimundo Espinosa, Ali Lopez, Michelle Liu, Luis Auerhan, Quincy Phillips, Frederick Liang, Araceli Gonzalez, Gerard Manuel, Jeremy Bruce, Philip Nguyen, Yvonne Perez, Kira Kazantzis, Derek Grasty, Roy Hirabayashi, Matt Reed, Walter Wilson, Araceli Sierra, and Sam Kahinde.
I guess I had not put up my hand. So you can see my hand now.
Yes.
Yeah, we see your thumbs up. Yep.
My
thank
thumbs
you.
up, yeah.
Thank
So
you.
that's 28 then?
I see 24 hands. Unless someone lowered their hand, we have 24 task force primary members who have their hands up right now. And now I see 26. So 18, 24. Okay, I count 26 here. I mean, I didn't count how many names I read off here, but I count 26 right now.
Carlos, I don't see Dolores's hand raised. Are you counting her?
Yeah, she had a thumbs up. We counted her. Did you count her?
Well, no, let me see if I can find you, Dolores, because I think what we should do is we should make sure that you're using not the I guess I can't do that. If you can, you have to use the reaction for raise your hand, not thumbs up. Because I think if otherwise
Okay, I will.
Otherwise it goes down. Yeah.
Yeah.
Oh, gosh.
I wish I could do that for you, but it looks like I can't.
Well,
But
if you click on reactions, Dolores, do you see the icon at the bottom of the screen? It says reactions.
If you click on reactions, the very bottom one is raise hand.
Yep, then it's raise hand. At the
You know,
bottom.
the problem is that I'm on my phone, so I can't see everything. Can't I just vote verbally? I am voting verbally right now.
Yeah. So yeah, we count with you, then we have 27 yeses.
Okay.
So it looks like of all of our task force members present, there is a unanimous approval of it. So I don't know, Rosalind, if I guess maybe we can, I don't know if it requires a vote, but approving these via consensus.
Yes, so unfortunately, we didn't make quorum. We needed at least 28 members, but I think given the fact we have 27 members voting yes, That's unanimous. I would ask the task force members, would you be comfortable with a consensus? It would not be an official vote because we did not reach quorum per Brown Act rules.
Did we start with a quorum?
No, I think we've
We
been
did not.
trying to get to 28
Yeah.
since the beginning.
Who's missing?
Yeah, I had the same question too, Dolores.
Because
I don't think we could vote then.
we don't want to stop this process. Maybe we can call them tomorrow or something. I don't know. This is not good.
Can we
I was
take
even
5
thinking-
minutes and try to get someone on now?
Yeah, that's what I was thinking.
Yeah, we
If
have time still.
If you members have connections with your fellow task force members and you can text someone, think you could get a hold of someone who could join the call real quickly, that would be great.
Well, if you know of, I mean, should we read off names of folks who may not be here?
Yeah, so it would be good if we didn't call people who are already here. It's a little hard to see because it's 2 screens.
Okay.
The one and only trouble with calling people at the last minute is they don't have the full picture of what we've done. They can, of course, hear the motion as it is, but they won't have the backstory, if you will, of everything that we've done up to now.
They could
But I
just vote present and we'd still have a quorum.
That's correct. They could vote no, and we would still be able to get the business done.
That is correct.
So can we
Or even
not
abstain, right?
here?
Yeah, they can vote no or abstain, but if that one person comes on, it'll be a quorum. And the total of 27 can move forward.
Yeah.
So Catalina,
I know that someone is contacting a task force member as we speak, and we're thinking we'll be able to get that person on the call. So we've got one underway.
Is there
So
anyone from the Indian Health Center present?
Dr. Anu Balakrishnan or Gerardo Loera, I think are the ones for the Indian Health Center, and I don't think I see them.
You don't see
here.
them there? Okay, Dr. Anu is in India, so I don't think she's there. So I'll try to reach Gerardo.
So I think the call, you should actually request them to come on the line to establish the quorum, and then they can.
Exactly, yeah.
The second action is taking action on the action.
And I just got a response from Maribel Martinez of the Santa Clara County, I should know, Division of Equity and Social Justice. She mentioned to me that Angelica is there as her alternate. Angelica, are you there? And were you one of the folks who voted?
I don't see an Angelica.
Okay, I just checked in with Maribel. She's gonna try to log on right now, so give me a second. And I think it looks like we're already making efforts, so I don't know if we need to request other people to reach out, but I think Juan of our consultant team has offered to name some of the people or organizations who are not here. So as I send the email to Maribel, I can allow space for Juan to share.
Yes, hi, good evening, everyone. Would you prefer that I name people off or simply screen share the attendance list I have so far and who's not here?
I think if you tell us, I mean, we can, like, I can see the list on the website, but we can't tell who's not here.
Okay. There's no one from First Five Santa Clara County, Buckley Bloom, or Ashley Robinson. Someone from Grail Family Services, either Carmina Valdivia or Yadira Grajeda. Dolores or Wright, someone from the Indian Health Center of Silicon Valley. If Gerardo, Dr. Anu's alternate, could attend, that would be another option. Someone from the Billy DeFrank Center, either Gabrielle Antolovich or David Morse, the alternate. If anyone knows someone from the Greenbelt Alliance, either Jordan Grimes or Zoe Siegel. Someone from Prosperity Lab, Mimi Hernandez or Armando Ricardes. Someone from Work to Future, Monique Melkor or Sangeetal Dral. Someone from the San Jose Chamber of Commerce, Task Force member Monique Yamamoto or Derek Seaver. Someone from Sacred Heart Community Service, either Pancho Guevara or Roberto Gil. Someone from Unite Here Local 19, Raquel Alvarez or Sarah McDermott. Someone from Makla, either Ruben Escalante or Marala Perez. Someone from the Bill Wilson Center, either Sparky Harlan, who mentioned ahead of time wouldn't be able to make it, or Marcos Torres. Someone from the Racial Equity Action Leadership Coalition, Susie Rivera or Darcy Green. Someone from the Evergreen Islamic Center, Mukatir Shaikh or Mir Mustafa. Someone from the Laborers International Union of North America, Local Union 270. That would be Luis Arguello or Enrique Arguello. Someone from Healing Grove Health Center.
Juan, I do believe Maribel Martinez just joined the call.
Fantastic.
Oh, yay.
Maribel, are you there?
Carlos, first five, who are the two reps on first five?
It was Buckley Bloom and
Ashley Robinson.
Okay. But I do see Maribel is on the call. Maribel, are you there? Or I guess maybe can you raise your hand if you or give us a thumbs up, because I don't think we can hear you. But I do think we have, with Maribel on, it looks like her thumbs are up, thumb is up, so we have quorum.
Oh, okay.
Maribel, thank you for logging on. I hear you're traveling, and it looks like we can't hear you, but we have, so far, of all the task force members here, there's a unanimous consensus to approve the task force recommendation. So I think with the consensus, with the 28, I think we are good now. It looks like, I think Veronica from Grail is also has logged in. So now we have 29. So I think we have quorum. What's that, Sam?
Do we need to take that vote again, or do we use the one that already been voted?
I think, I mean, we can, I don't know if we should, what do you think? What do you say, Rosalind? I'll defer
No,
to you.
I don't think, I think given we've got the number of yeses for the members who've just logged on, we can record their votes as abstaining because they, unless they want to vote, we can give them the option to, but given they haven't been part of the conversation, but at least we've met quorum. That's the key thing. And obviously it's more than a majority of hands raised.
Thank you.
Okay, so then it looks like we have the approval of the motion. So the motion passes. All right. Well, that is a moment of celebration, yes. With that done, with this this work, this essentially completes the process of the task force. So while I think the process for you we're ending this process of the task force, it's really just beginning for us here at the City of San Jose. So I think, as you can see on the slide, we'll be talking about next steps. And so I'm going to hand it off to Aurelia.
All right. So I feel like Rosalind already went over with all of you of some next steps. And so just wanted to just reiterate what was already been said and talked about for some next steps. And like what Carlos had just said, again, this is a work in progress. A lot of it is already in motion. And then with all of the recommendations that you guys have made tonight, we'll make sure to capture them here. So the first one is we're going to be publishing our task force report. As you already should have gotten or received the draft report that was sent out to you this week. And then on December 6th, there's a presentation to City Council. We will be sending out an email once we have the agenda, and our council meetings are actually hybrid. So everyone here is welcome to attend in person or virtually. We will be evaluating the task force process. There will be a survey. We'll do a formal evaluation of this process. So we really want to hear from all of you what worked or anything else that we could have done better. And then the big bulk of it, of the work, is the developing the implementation framework, the work plan for the 10 recommendations with funding allocations, finalize impact metrics with city staff and partners, who you'll hear next from Ali, and then coordinate with lead departments and entities on other recommendations. And as you mentioned, to go back to the Community Economic Development Committee, since staff already has been doing quarterly reports to them. So going back to that, the biannual updates to them. The last thing that I did wanted to mention is, before I hand it off to Ali, is that we are looking for one committee chair or a co-chair to possibly present with us at our December 6th council meeting. So if any of you that's part of this call tonight that is interested, please email us and let us know, and we'll make sure that we include you part of that process. So with that, I'm going to...
Aurelia, I'm sorry to interrupt, but just a couple of things on the presentation to City Council on December 6th. First, just to note that that meeting is going to be starting at 11 o'clock because we have a very heavy City Council agenda that day. Right now, there are 15 items. So just wanted to give you a heads up. That meeting will be starting likely at 11 o'clock. If any chair, co-chair is interested, please do email us if you'd like to be a part of the presentation. I will say that due to the heavy agenda, everyone presenting has been asked to keep presentations very concise. And so we're anticipating about a 5-minute presentation on all of the highlights. So just wanted to make sure you all have those additional notes. And I see we've got questions now, and I'll just start. Dr. Dewan.
I don't have a question. My hand was still up from the vote.
Oh, from the vote. Sorry.
I'll take it down. Thank you.
Okay. Raimondo. You're still muted. We can't hear you. Oh.
There we go.
Yeah, no, I need to put my hand down too.
Oh, okay. That's fine, no problem. Christine, is it your hand up, left over?
My hand is up for a reason.
Go right ahead.
Quick question. Meeting starts at 11. Do we know where in the lineup this would come in?
That's a great question. So we anticipate that we are going to be the first item on the agenda. So after the council ceremonial items and their consent calendar, like we never know if an item gets pulled off consent. If it does, how long that discussion would take. But right now we're thinking that since we're the first item, we'd be up within an hour. So thanks for asking. That's a good question.
Yeah, thanks.
Thanks, Christine. Any other questions from the task force members? All right, before I hand it off to the last committee, I know at the last task force meeting, we heard from all of the committees. Tonight, we are going to hear from the Data and Budgeting Committee. They have been participating in all of the committee process, and so Ali, who is here tonight representing that committee, is going to talk about the potential impact metrics with all of you. So with that, I will hand it off to Ali.
Thanks, Aurelia. So as Aurelia stated, these are the potential impact metrics, the high-level indicators that the city staff will be working with. I'm not going to go through all of this as time is of essence, right? So anyways, she did state the Data and Budgeting Committee participated in all of the committees and developed these in response to what we heard in those meetings. Now that we have solidified the recommendations, city staff can begin to move the recommendations forward. Staff will fine-tune the metrics as they move forward into implementation so that they can report to City Council. So our staff is going to be very busy. Thank you. I'll hand it over to Carlos, unless there's questions.
Thanks, Ali. All right, Carlos.
Carlos frozen? He hasn't blinked in about 30 seconds.
Oh my goodness.
Carlos might be frozen.
I think he is.
Aurelia, do you want to take it?
Yeah, so, well, as Carlos is trying to log back in, first of all, we've been mentioning this, that we could not have done this work by ourselves, and that this work is done with the whole community and with all of you. We've been mentioning at the very beginning, we can't believe that we have been together for about a year, or for a year now. And so just a few highlights with all of you, that we've had 12 task force meetings, over 20 hours we've spent together virtually. Some we've actually met with you because you all have done some volunteer work besides being part of this task force. We've met 73 times. We've had some 73 committee meetings of all of the 9 committee meetings we've had, a total of 76 hours. And I think this portion of it, we wanted to hear from all of you. We wanted to reflect, the steering committee felt that this is something that was important to all of you, and we also want to hear from you. So reflecting from hearing from all of you, what was important, what's the most important thing you've learned through this process? How could it have been improved? And what did you appreciate about this task force process? So we're actually going to pause right here for a minute. And we would love to hear from task force members. You don't have to answer all of these questions. Feel free to answer whichever one you feel that you'd like to, that you would like for the members to hear from. So anybody want to start? Welcome back, Carlos. Yvonne.
Thank you. Well, I think a lot of people have mentioned that I just want to say I'm grateful for the opportunity. I'm grateful to have worked with all of you, and I just want to say kudos to everyone for all the hard work and efforts and dedication that you have put to this effort. And one of the things that the most important things that I have learned through this process is the importance for connection. I think during difficult times, connection has been extremely important in the way of checking in with our neighbors, in a way of checking in with our coworkers and so on. The other thing that comes to mind is community, this ability to not only, connect, but really build community for the greater good for everyone. The other thing is commitment, because without commitment, we can't move forward. I know there's a lot of work ahead of us, but we need to have the commitment to make that effort. And I think as a task force, we have been committed to all this work, and we want to make sure that that gets carried over in what is to come. And for that, we need the consistency to continue the work, right? We need to be consistent in our efforts, in our communication, and our planning. And lastly, the importance for resiliency, because the work has just begun. There's going to be potential challenges, more conversation in regards to different recommendations and so on. But as long as we're able to stay resilient and make sure that we keep what is truly important at the center, which is the people that, that all of us serve at different capacities, I think we would be doing well. What I appreciated about the whole process and task force is just the ability to work with amazing people, people that were very professional, respectful, and committed to the work. As a committee member, I felt that my comments and recommendations were listened to, and that is, that is a very nice feeling to feel that and to know that. So, thank you for all the work that you have done. That's it.
Thank you, Yvonne. Kira.
So one thing I just want to recognize is that the community asked for this process, and I feel grateful that we were able to see it through, that we were lucky enough to get together, and that all these community members and community leaders were able to work together over this years-long process. I think it showed that we can center community voices at the table to solve community problems. And I think that's a lesson that I hope we all take as, community members and advocates. And also, I hope the city sees this as a benefit as well. Definitely want to appreciate the city staff and consultants who worked on this, because I know there was a lot of cat herding, and specifically want to call out Carlos, who is a saint. Incredible amount of patience, and I mean, there's lots of names that we could say, but definitely, I don't think I ever saw Carlos flustered, and we're not like a totally easy group to herd. Also, really amazing co-chairs, specifically thinking about Araceli. Would like her to speak at City Council if she's willing. She's a great co-chair of one of the 3 committees I was mostly on. So just thanks to everybody for bringing yourselves and your full selves to these meetings, and had lots of honest conversations and productive, and I hope to see you again at the next task force.
Thank you, Kira. Christine.
So thank you. So I must say that this has been one of the most productive task force that I've been on, and that's saying a lot, because I sit on a lot of different committees and all sorts of things as a part of my job. Some amazing people, dedicated people doing lots of different jobs, lots of different work, coming here on a regular basis to pitch in and make things work. I'm very grateful that this was able to remain hybrid throughout all of this, considering that, we may be done with COVID. We may be so over COVID, but COVID is not done with us. And to be able to recognize that the hybrid ability makes it so much easier for anyone to be anywhere and contribute. Like we just saw scrambling to get everybody here to make at least quorum or as much as we could. Fantastic job. Let's keep on fighting the good fight. The hybrid situation right now is up in the air. I really highly recommend everybody send emails to the governor saying that it must continue and must not sunset. And I appreciate all of you, appreciate all of your work. Thank you so much.
Thank you so much, Christine. Robin?
Hi, I'm Robin Treen, and I'm the alternate from the San Jose Museum of Art, so I'm probably not supposed to say anything, but I did want to just say that I really appreciate the city's commitment to listening, to really seeing through and really trying to hear what the community had to say. That is not an easy thing to do. People are very quick to complain, and they're very quick to say what they don't like. It's much harder to get them to offer up solutions to problems. And to me, the thing I find the most interesting about that is that people oftentimes, regardless of sort of where they come from politically, they often come up with the same solutions. And so I think it's a really good thing in terms of looking towards the future and building resilience to actually, as somebody else said, to really center community voices in looking for solutions to problems like this. So I really appreciate that the city was willing to do that and see that process through and didn't lose their patience with us, and to really stick with it and help us find ways, help us understand the system so that our voices could be heard in a way that was meaningful and that actually will make a difference in the end. Because if you left that up to us, we would not know how to do that. So I really appreciate the structure that was put in place to allow those voices to actually be heard in a meaningful way. So, and thank you, Carlos, you've been great.
Thank you, Robin. Sam?
Yeah, sorry about that. I just have a visit on my desk right now. So I just want to echo what people have been saying. But for all of you guys patient, at the beginning of this, I didn't have no idea what what we're trying to accomplish. Even as many times you guys repeat that. But as the process continued going, for Rosalind, Katrina, and all of you, or Carlos, for your patience, even trying to take a note when people just feel like we're just speaking, and you guys find a way to capture down the note. It's a great skill to have. And I think City of San Jose are lucky to have you all working for the City of San Jose. No wonder the San Jose is the best city in California, if not in the country. So because of all the work that you all do, does every day. And personally, helped me to connect with people on my committee. So we learned together, we went through the process together, and I know many of you guys by faces, by name. And I think if I saw you on the street, I can say hi and, introduce myself. So thank you for opportunity to be part of this. If I can just make a recommendation, I think it'd be great if the city can consider, for all of this committee who really work really hard for at least since beginning of the year, if I remember very well, to send some kind of certificate, be great. Say, task force COVID-19 relief, whatever they call it. So can send some kind of recommendation to those folks to appreciate all the work that they have done. Would be greatly appreciated. So yeah, thank you.
Thank you so much, Sam. Before we allow others, we are planning some opportunity to recognize you all. I don't know if it's already been mentioned before, but we are having the tentative date of December 13th at the task force at the city council meeting. So hold that opportunity, hold that date. We are exploring opportunities to recognize you and our lived experience group for all the contributions you made. And we're also trying to, if there is interest within the task force to among the task force to organize some kind of social gathering. I think it was brought up at last month's meeting that there is that this is something that we could organize should there be someone in the task force or a few task force members who want to help coordinate. So if you're interested in a social gathering, maybe give a reaction here, a thumbs up, so we can see if there's interest among task force members to organize something, and then we can maybe follow up through email if you're interested in helping us coordinate something. It could either be for December 13th or at some point around then. Jesus, go ahead.
I'm all in for a social gathering. I just want to echo the comments, the previous comments. Thank you to each and every one of you. Every time I'm in a task force like this, it is always learning experiences. So I want to thank you all and for the effort. Thank you to the City of San Jose, of course, the Office of Economic Development, precisely Carlos, Aurelia, Lillian. I don't see Lillian here, but Rosling, Ralph, and everyone at the office. Katrina, thank you for all your support, especially in our group. I don't know how much work you did in the other ones, but you did a lot of work with us, and I thank you for that, Carlos and Lillian. And obviously, I want to thank also our committee members. They were great. I am seeing right now Derek and Christine. Christine, you were fabulous. You were great. Thank you for all your support. Just as they were mentioning, I hope this group, I know how hard it will be, but I just hope this group can continue. And yeah, I will love that. And again, for the social gathering, count me in. I want to be there.
Eso.
We have you down, Jesus.
Araceli Gonzalez.
Thank you. I also echo everything that everybody is also saying. Christian and Carlos, thank you for everything that we're putting things together in a quick manner, weeks, days. Also the lived experience, thanks to them. Just listening to what the community has been asking for a long time, and all the organizations that got the lived experience together. Just want to give a special shout out for that. So just thank you, everybody.
Thank you, Araceli. Dolores?
I'm here. I'm
Go ahead.
here. Thank you. I'm not going to repeat everyone just said. Just want to echo everything they said. I want to agree with that. I do want to give Carlos and staff special thanks for really for understanding and really going above and beyond the call, understanding healthcare. Healthcare has not been an issue under the responsibility of the city for a long, long time. But interestingly so, I wanted to share with all of you that the consortium of community clinics was founded by the City of San Jose and with a $30,000 seed grant. So I don't think everyone knows that. So you took the time to understand and to ask me the hard questions, and have special meetings with the folks from the Health Trust, with Michelle, with Victoria, and with me, to really understand what it was we were trying to get to, particularly around emergency preparedness. So thank you, very, very grateful to you and to Juan for working with me on that. And the last comment is, I will never say no to an opportunity to have a party and a celebration. So count me in.
Thank you, Dolores, and thank you for calling out Juan, who has been an invaluable part of our consultant team, as well as Kim Dorman, who is on this call, and Frank Ponciano, who has also helped with organizing the lived experience group. Quincy?
Yeah, what's up, y'all? Plus one to everything that everybody said. I definitely needed to make sure that I was seen, heard, and included in this. I just want to also add a bit of all of the things that we learn and appreciate. The consultants, man, you all have shown up as well. So, you know, the teams, so the Carlos, all of you, Rosalind, Aurelia, all of you all have, you know, have been amazing. But I also want to shout out the consultants because you all have brought a lot to this as well, allowed us to see things, you know, a lot clearly. That process was made a lot more efficient because of it as well. So really big shout out to y'all. And again, looking forward to seeing what happens after this.
Thank you so much, Quincy. Araceli Sierra.
Yo, ¿verdad?
Sí.
Es que vemos dos. Pues yo también igual quiero dar las gracias. Creo que a todos porque realmente aprendí mucho. Creo que es mi primera vez que soy parte de un comité así tan grande para poder dar las opiniones de la comunidad y poder tener esa voz que a lo mejor muchos papás, muchas personas no tienen el tiempo, pero cómo podemos llevar aún así sus experiencias, igual las mías. Creo que también estoy muy agradecida por eso de que creo que soy de las únicas que habló español nada más. El tener la traducción fue algo que me ayudó muchísimo. Adentro. Adentro, sí. Quiero agradecer también por eso, porque creo que en las primeras dos juntas fue donde me sentí un poco rara, pero después me hicieron sentir bienvenida en todo momento cuando daba mis opiniones y todo. Ay, estoy despeinada. Y pues quiero también resaltar que a pesar de que ya soy miembro de la comunidad activa y siempre estoy como buscando esos recursos que pueden ayudar a la comunidad, creo que me encendieron esa llamita de, aparte de buscar esos recursos, también empezar a mirar eso, las leyes que pueden beneficiar a nuestra comunidad, el cómo seguir más involucrada en la ciudad o cosas que puedan ir un poquito más allá. A pesar de que no tengo los grandes estudios, me hicieron sentir parte de todos juntos, yo dando mi conocimiento como parte de la comunidad, pero también aprendiendo de ustedes todos sus conocimientos que compartieron. Quiero dar las gracias por eso. Estoy súper emocionada. Creo que voy a seguir un poquito más activa de lo que ya era para seguir aprendiendo sobre todos estos maravillosos recursos y cosas que hay. Y también a lo mejor algo que para mí me hubiera ayudado, escuchando todas las recomendaciones que hicimos, que fueron bastantes, y por eso pues se va a llevar más tiempo el poder llegar a un acuerdo o poder llevarlas a cabo. Me hubiera gustado que se pudiera, antes de hacer esta votación, que se hubiera podido como resaltar las recomendaciones que todos dimos que ya se están haciendo o que ya estaban en proceso. Creo que a mí me hubiera ayudado más para el poder decir, ok, esto ya está, esto no está, pero vemos que se necesita, como quizá para encontrar realmente esas prioridades que no se están haciendo, pero hacen falta. Pero, y sobre la celebración, me avisan. Muchas gracias por todo, Juan, Carlos, que me tuvieron mucha paciencia y por estarme traduciendo siempre.
Thank you. Muchas gracias, Araceli. You guys are all going to make me cry. Big chillon here. So are there any other comments or questions? Comments? Raimundo.
Can you hear me?
Yes.
Okay. No. So I second the emotions, right? that everybody's mentioned. I appreciate the fact that you had a questioning a mind. If you didn't know something, you tried to, take a deep dive and try to get more out of us to try to figure out what we wanted to do and how we wanted to do it and what experience we had in order to do it. So I really appreciated that. For me, the one piece that I think we haven't talked about, but I think is critical in my opinion, is that I think COVID brought together a lot of us to meet an issue and combat an issue. And a lot of that was not only the city, but the county. And I know that from a health perspective, we focused on the social determinants of health. But I think that we also need to have a conscious interaction between the county and the city to ensure that we continue in the mode of COVID, of working together to try to resolve issues. And that wasn't necessarily a criteria identified here, but I think it's something that we should keep at least on the forefront of our minds, because I think dealing with issues takes all of us, from the city to the county to the nonprofits to the individuals in the community. And I think if there's a way to continue to maintain that effort, I think will make us successful. And yeah, I'll join the party.
Eso. Thank you, Raimundo. Anybody else?
Rosalind, can you email us the line that you always said about giving the, thanks to our ancestor? I love that thing, so it's great, to appreciate that. If you can just email that
Sure,
line.
absolutely. I'd be glad to, Sam. I'll send it out to everybody. Yeah.
Thank you, Sam. Hugo?
Yeah, I'll be very quick. Just wanted to highlight and uplift the cross-sector work that we did. And I think that was a very good strategy to do that. I learned a lot from other sectors that were in the committees and on this call and on the task force. And I think that was a really important strategy to make sure that, we all kind of brought something different to the table and solving a very complex challenge like this, and maybe not solving, but at least, getting somewhere, and it helped me a lot, and I'm sure it helped others. And so I hope, including, I think, the lived experience group, that was also a very important, critical element. And so that's my thing there. I think an area of growth for us, I always like to get more, engage more, right? So I think just trying to continue to work at engaging as many people in the work that we're doing like this. I think we did a really good job, and props out to the group, the community engagement committee, and they did a wonderful job. And so I think just continuing that as well, uplifting that and growing in there. So thank you all.
Thank you, Hugo. Anybody else?
Carlos, may I say a final word, if you don't mind?
Sure.
This is a comment to the group. I forgot to thank everyone, of course, but more importantly, there is nothing that can stop us from continuing to meet in some form, maybe quarterly, and continue to be watchdogs for what happens to the implementation of our recommendations. I mean, we can do that in a non-formal way and yet continue to have impact. So if anybody's interested in talking about that, I'm happy to get us together.
It's a great suggestion. Thank you, Dolores.
Thank you.
All right, Yvonne, one more.
Yeah, I just wanted to say, count me in, Ms. Dolores. I'm up for that as well. And I just wanted to add thank you to Rosalind for all your leadership and work. It's reflected on the entire team. Everyone has been excellent. I have nothing but great things to say about everyone. So thank you so much.
Thank you, Yvonne. All right, unless there are any more comments, we look for, already received so much good input. As Aurelia mentioned, we if you didn't have a chance to respond, we will give folks an opportunity to provide additional input through an online survey that we'll be following up with in a couple weeks. So I'm going to breeze by this. I think we heard throughout the comments about how community engagement was centered in this process, and I'm just truly grateful for what we were able to accomplish this summer through the connecting with 1,500 people, the activities and organizations that folks brought up, the lived experience group. So this is all thanks to you and your commitment to your communities and the efforts of our lived experience group. I know Ellen is here, so thank you so much. I'm just proud of what we were able to accomplish together, and we look forward to working with you and continuing our efforts to serve these communities. So I think the last item is public comment. If there is any members of the public who would want to share a comment, this is the opportunity to do so. Gabriel.
No, just to let Raimundo know that 1.6 of the health committee actually speaks to the coordination of the city and the county. So that is on the list. Amazing, right? And then if people are looking for a party, San Pedro, starting on November 20th at 5 o'clock in the morning, the World Cup begins. And so there'll be a party from 5 to about 11 or 12 every day during that. So if anybody's an early partier, I would just put that out to everyone. Congratulations to all.
Thank you, Gabriel. Yeah, I'm looking forward to those 2 a.m. games that are being scheduled. Any additional comments from the public? Okay, so the last slide, I think that completes the process. So we'll send up an email either tomorrow or Monday with information on the updates that were shared, the events and activities, to make sure we share that, and we'll follow up with if you're interested in co-chair or committee, co-chair or chair who's interested in speaking, let us know by email. And if you're interested in helping coordinate the social gathering, let us know, but we'll probably send that out in our email on Monday to let us know. Rosalind or Rob, any final thoughts, comments?
Just a lot of appreciation. I'm sorry. Or I didn't know I was going to get emotional, but just a deep amount of appreciation and gratitude for your service to our residents. And that's the most important thing. This was all about helping those most in need. And we appreciate you coming alongside us to do that. Lord knows there's a lot more that we have to do. And I will say on behalf of staff, we don't mind being watched. We don't mind being held accountable. This is what we get paid to do. So I'm looking forward to the next phase, starting implementation and presenting updates to our community at large. I'm just grateful for Rob, for Aurelia, for Carlos, for Katarina, for all of the city staff. We had city staff participating on committees, helping us out. We were driving them crazy, sending them emails and just a lot of coordination. So just tremendous thanks to staff. Tremendous thanks to this amazing consulting team. So Rainy and Winter, amazing, amazing professionals and colleagues. And I think we call you friends now too. So thank you so much. And so our work is just starting. We mentioned this process for us is beginning, it's just starting. One of the things when we looked at all of the highlights of the feedback that we got from our residents that we engaged, one of the things that bothered me the most was that they simply did not know about services that were already being offered. And I'm like, dang, that's really bad. That's for us, the city, that's bad. So that's something that I'm going to work on. I think our team is going to work on. It's like we have to make sure that our residents, our small businesses, our neighbors, that they are aware of the services that are already available. So that's where I'm so thankful for the promotores who are out there sharing information. Like, we've got to continue to double down on connecting people with resources. So our team is committed to do that moving forward. So with that, I just say thank you so much. It was a pleasure working with you for over this year's time. And I'm going to turn it over to my colleague, Rob.
Yeah, well, I'll try not to overclamp as well. Thank you for teaching so much. And if we're defined by how giving we are with each other, I think our community is in good hands. So thank you.
So with that, thank you again. Have a fantastic evening. We will be in touch with you, no doubt.
Thank you, everyone. Have a great night.
Thank you.
Everybody.
Thank you.
Thank you.
Bye.
Nice.
Thank you all. Bye-bye.